So we will obviously have this recorded. Here's our topics for today, and with next steps, we'll also some time for some questions and answers. So thank you all for being here, and really glad to turn it over now to Dr. Katie Brown to talk about utilizing Binex Now for follow-up testing. And Dr. Brown, just please tell me when to advance the slides.
Oops, sorry, I was on mute, of course. Sorry. Good afternoon, everyone. And thank you, Russell, for inviting me again. Really happy to be here to help talk through the uses of Binex Now in Massachusetts schools. And so I assume that many of you already know that schools currently use the Abbott Binex Now antigen test to test students or staff who have symptoms of an illness which is consistent with COVID-19. And this is sort of the, the recognized usage for this particular antigen test. But in addition to that current use, Binex Now is now going to play a really important role in the Commonwealth's pooled testing program. So, I mean, the sort of the high level 90,000 foot view is that when the results of a pooled test come back positive, what's going to be important is to try to identify the individual or individuals in that pool who are positive, right? Because you won't know that just from the pool test. And so at this point, we are recommending that schools can use the Binex Now to determine which of the individuals in the pool is positive. So next slide. So, I can imagine that recommendation would make you ask some questions. And those would be, this is a test that we know is, it is very appropriate when we have somebody who's symptomatic and we want to see if the cause of their symptoms is COVID. And so that's when we use that antigen test. But this is sort of an expansion of that recommendation, and I want to let you know kind of why we feel comfortable making this recommendation. So, that one of the huge advantages of the Binex Now test is that it's a point of care test that can provide very rapid results in minutes versus the 24 to 48 hours that it can take for a PCR result. But that's fine, and is only useful if the result that we get back is also helpful and accurate. And so we wanted to be able to make sure that the tests were able to function in this for this intended use as well. And so our director at the Public Health Laboratory and several of us also at the Department of Public Health worked with a drive-through testing site in Lawrence, Massachusetts, and we worked with several other researchers and physicians as well to do this. And the goal was to do side-by-side testing from individuals taking both a sample for PCR and running a sample for the Binex Now test. The real advantage to doing it at this Lawrence site was that it was a high throughput site, so we had a lot of people going through, and we were able to get samples from both children and adults, obviously very critical as we're talking about using this in school. And not only were we able to use it in both children and adults, but we were also able to test both symptomatic and asymptomatic children and symptomatic and asymptomatic adults. So got a broad sample of data in which to understand how good the test actually is. So next slide. So there was a lot of data that came out of this, and I'm not going to try to overwhelm you with all of that. We're going to get just to cut to the chase, which is that. So, sorry, let me step back for a second. So when you test someone for COVID using a PCR test, you you can get an assessment of how much virus is actually present at the time that you did that test. And it could be a large amount of virus, or it could be a low amount of virus, or obviously in the middle, right? And the PCR test kind of gives you that idea, gives you a relative idea of how much virus is present. What we know is that people who have the higher viral load, so more virus in their nose and upper respiratory tract, are more likely to be able to transmit the virus than people who have a low amount of virus. I think that's relatively self-evident why that might be, but it is also borne out by studies that have been done on this. So when someone first gets sick with COVID, they are like, and become symptomatic, or even if they're not, they are going to have a lot more virus in their nose than they are kind of towards the later part of their illness. So it just declines over time. They're most likely to spread at the beginning. So the people that we really want to detect when we're talking about reducing transmission are those individuals who are early in their infection and have a high viral load, right? These are the ones that are most risk, provide the most risk for transmitting onward. And so what we found doing the assessment of the Binex Now side by side with the PCR test was that in individuals, both symptomatic and asymptomatic, who had a lot of virus present, the Binex Now test was excellent at finding those people. With a little bit less virus, kind of in that medium range, it was not quite as good, but still very, very effective. I mean, at 88% to 95% is still a really excellent test. And it's those individuals who have the lowest viral load where the test didn't perform as well. But that's okay, because those are not the people who are, really posing the greatest risk for transmitting the disease onward. And so when compared to the PCR test, which is a gold standard, the Binex Now is accurate, is highly accurate at finding COVID-19 in people who have either a moderate or a high viral load, even when they're asymptomatic. Again, these are the children, the people who are most likely to be highly contagious and transmit the disease. And so this is why it's these results that make us confident that the Binex Now can be used, you can go to the next slide, can be used to test asymptomatic children following a positive pooled test result. And so again, across symptomatic and asymptomatic children, the Binex Now is very good at identifying individuals with moderate to high viral loads. The definite advantage of the Binex Now is it provides results in 15 minutes, and it means that you can rapidly institute isolation and contact tracing and quarantine. And given sort of all of these things taken together, the accuracy of the test, the very fast, results, the point of care use of it, the price, which is good, and the widespread availability, we really think that Binex Now is an important part of this pooled testing and initiative, and is an effective way to follow up on positive pooled test results. Russell, I think that's it.
Thank you, Dr. Brown. I'm sure that there are further questions about this, and I should just interject at this moment to let people know that we plan on 2 webinars next week that I'll explain at the end of our presentation today. And one of the webinars is specifically to go deeper on this topic of Binex Now. We felt like we had to bring this information to you today. We thought it was a really important and timely topic to do at least 10 minutes on in this presentation. And we'll see if we get to some of your questions during the Q&A at the end of today's session. But we're also devoting an hour to this topic, solely to this topic, next Tuesday, and we can definitely go deeper into the discussion and into the data as well. So with that in mind, I just want to take a look at a few things for you to know about our updates to the use of Binex Now. What's important to know is we are simultaneously keeping open what we were previously doing, which is allowing districts to use Binex Now for symptomatic individuals only if they want to sort of do what we were doing under what we called phase 1 and continue on with that, that's fine. That's available, and we want, if districts are interested in joining solely for that purpose, they certainly can. But for the purposes of today's conversation, obviously, there are many districts that need to sign up for Binex Now in order to take advantage of pooled testing. And while there are several next steps for you, this is a key one. If you are not already signed up for Binex Now, we would ask you to please do so as soon as possible. And so what we've included in the slide, in the middle of this slide, are those steps that you need to take. And we'll say a little bit more about the CLIO waiver moving to a statewide CLIO waiver instead of an individual CLIO waiver that each district previously had to get. That's an update, it's a change, it's an improvement. So we'll say a little bit more about that on the next slide. But right now, getting the standing order, the PPE in place, and the consent and to test and get the results reported are all included on the website addresses that you see, the links that you see there. And at the end of it, once you have all those prerequisites in place, you will complete a readiness checklist and submit it to the email address that you see there. And we'll have the readiness checklist. It's right now definitely on the symptomatic program part of our website, our webpage there, and it will soon be on the follow-up and consent reporting for pooled testing webpage. So wherever you go, find your way to our readiness checklist, fill it out. If you have questions, please send them to that email address that you see there, and we will get back to you. We will be glad to help you with this process, but we'd certainly encourage you to sign up for Binex Now as soon as you can. That's an action you can take immediately to get ready for pooled testing. So a little bit more about the statewide CLIO waiver. Previously, all districts would have to submit their own request for a CLIO waiver. And what I'm really pleased to tell you today is that there is now a statewide CLIO waiver, DPH, and thank you to Dr. Brown and so many others at DPH who helped to establish this. Districts essentially, and Dr. Brown, please correct me if I'm wrong or if I misspeak this in any way, but districts can essentially sign on to a statewide CLIO waiver instead of having to apply to get one themselves. That should really speed up your process. That should make it a lot easier for you to be ready for Binex Now by early February when we start this initiative. And so what we need you to do is just to fill out a survey that you see here in order to get into the statewide CLIO waiver. Dr. Brown, did I miss anything there about what it means to take part in the statewide CLIO waiver?
I don't believe so. I think that was perfect.
Great, thanks so much. And then we have the consent and reporting forms to look at too. And so anything that you need to know about Binex Now is on our website. And if you go there now, it's going to take you down kind of either track. Are you looking at kind of what we used to do with just using Binex Now for symptomatic individuals, or do you need to get information to sign up for the Binex Now, using Binex Now as a follow-up test for pooled testing? You will see either option there, and you can sort of, chart your destiny using our webpage. So I hope you find that helpful. So now let's go to kind of the really important things that you need to know in order to move forward with this initiative. On our webpage today, we are launching a wide variety of documents and resources. They include a really descriptive memo that you're going to need to look at closely, and I'm going to walk you through it in just a minute. And the 2 documents that you have to submit to us in order to be approved for pooled testing. We have a very detailed FAQ that we have made available for you. We've updated the FAQ actually that we produced last week with many more answers to your questions. We have a sample consent form and a parent letter, both of which will be in translated versions next week. And then all of our updated Binex Now documents are available too. So bear with me, I'm going to stop my share just for a second and switch over to where I have all of these lined up for you in my, here we go, this should do it, I hope. Move this bar real quick. All right, here we go. Let's start with the memo. So what you are going to see is that I want to just very carefully walk you through the memo that Lauren is putting in our chat right now. Predominantly because I know how busy you are, and instead of making a PowerPoint and a memo separate, This has just been something I've been doing a lot during COVID. If we release a detailed memo, I just want to walk you through the memo so that you know to come back to the memo. And everything that you need to know, I'm going to go over with you right now in kind of a brief version, and I hope you'll spend some more time with the memo, come back to us with your questions, and we'll make sure you get the support that you need in order to move forward. So just a reminder as we get started. So, again, you'll have this as a companion document. It's on our website, it's in the chat, but everything that you need, this memo, all the other resources I just mentioned are at this link. So please go there to get any additional information. And now, as we move into kind of the preconditions, this is really important. So as you move forward to confirm your participation, there are 2 key documents that you need to submit to us. And I'm going to go over them in just a minute. And as I mentioned last time, we want schools and districts to be ready to start. We think mainly most districts will probably start about February 8th. And so we want to get you ready for that. And so, you can fill out these documents later, whenever they're right for you. But if you want to get started as early as possible, we ask that you submit these documents by January 28th. And so if you can get this into us by January 28th, we can kind of prioritize you for the earliest launch possible. And we're going to ask you, do you want to start before February break? Do you want to start after February break? And so just, getting some familiarity with what you need to give to us today, I think will help you through the process. And so, as I mentioned, there are these 2 documents that we need from you. Here's the good news. We have combined them both into one survey. So when you go to our survey, and I'm going to show it to you in just a second. So see where it says, click here to complete the application to be an authorized school. It's going to take you to Alchemer, and it's going to look like this. So here's how we begin our survey. And the first thing that you're going to run into is that you have to upload to us a statement of assurances. And this document really outlines the responsibilities that you are going to take on in order to implement pooled testing. What's really important to know about this document is that it's been vetted by DESE, by Health and Human Services, and our vendors. And so it's basically saying, as a recipient of these services, there are certain agreements that we want you to make, certain, frankly, commitments to implementing this initiative with fidelity. And so it will start by asking you to download the statement of assurances, which looks like this. And it goes into a fair amount of detail about consent. It's just, you need to read this. This is, kind of the fine print on participating that you are agreeing to. And I don't think any of it should surprise you because working in education, we know that consent and privacy are always key issues. And so we've tried to just, put it in here in kind of simple language around, what does it mean to participate? What are the testing protocols? What does it mean to follow up? What kind of training is necessary? So I won't go through all of this document now, but I just want you to be aware of it. So keep in mind, there are 2 things you are going to upload into this survey. And the first is this statement of assurances. It needs to be signed by the superintendent or the executive director. So superintendent of a school district, executive director of a charter school, a collaborative, that sort of thing. So we'll want that authorized person. If you're not the superintendent and you're listening right now, we'd ask that you follow up with your superintendent, with your executive director, and help them understand that they need to review this form and be ready to kind of sign and agree to it. Keep in mind, that there's no contract with a vendor. The contract is with us. So we need you to sign this, signifying your commitment to this program. The second thing that you're going to see, and I had it kind of, again, remember two documents we need from you. That one seemed pretty easy, right? It's a wet signature. It's, scanning it, uploading it. That's not bad, right? We know how to do that. The second one is the application to be an authorized school. And so for that one, a lot of what we need from you is actually embedded in the survey. So when you click on that link, you're going to be asked first and foremost to upload those documents. So you're first going to hit that statement of assurances. You have to upload it to move ahead. And then the second thing that's going to happen when you get into this, this survey is you're going to be asked to give us fairly detailed information about all of the schools that are participating. We really need school level information to make sure that we get you the kits, the resources, the materials that you need in order to implement this initiative. So where the statement of assurances was at, I would call the district level, this spreadsheet is at the school level. And So I apologize to our larger school districts. This will take some more time to fill out, but it really is just a spreadsheet. And again, I think you shouldn't be surprised by any of the questions here. And having this information will help us get this information to our vendors so they can be in touch with you. It'll help us with the matching process to our vendors. And so I hope that you'll find this pretty straightforward and pretty easy to fill out when you're in that survey. So again, in our memo, we outlined for you 2 key documents that we need from you. They are all embodied in this one survey that you access by clicking on this link right here. So I hope that's pretty straightforward. We really did try to streamline this and make it as easy as we can. And just getting what we need, what's essential, what we really need in order to get you started. So then after that, after we hear back from you, and again, I just want to repeat, if you get this into us by next Thursday, even before if you can, that really helps to launch us in the matching process. And I'm going to say more about our vendors at the end of this memo as I go through it, but your response will help us with that matching process. So the memo then next goes into the preconditions for pooled testing. And no surprise, we need consent. You need to make sure that you're getting consent from your families or any individual who can offer consent for themselves. And so let me just show you really quickly that we have both. Here's the consent form, and it'll be on our website. So that one website that I showed you at the beginning of this memo, that's where you can go to get all of the documents, including, this is the student example, so completed by the parent or guardian. And this is just something you would share with your families. And again, we're getting this translated so that it's easy for you to use with all of your families, which is what we very much want. We also have a letter for you that goes with this. And again, these resources are all available now, available on our website. And this letter explains the consent form and explains participating in pooled testing. So again, we're just trying to give you kind of everything you need in order to move forward. I wouldn't say that this is, a next Monday thing, obviously. You can kind of get ready for this. You can start talking about it internally and planning for it. But when the time is right, we want you to move ahead with getting the consent form in front of your families so that we can, tick that off the box and be ready to have as many students and as many staff members participate as possible. So the consent form helps us with 3 things: administering the pool testing, administering the follow-up testing, and then sharing all of those results that come through the Binex Now individual follow-up testing with DPH, because DPH has to know both any positive and negative, all results have to be able to go to DPH. Sure, a question some of you are asking is, well, what if we don't use Binex Now? Keep in mind that we're not requiring you to, but you do have to have some form of follow-up testing. And so maybe this will be something that we follow up with you on in a subsequent webinar. Is if you're going to need to kind of alter any of these materials, the letter obviously is customizable, the consent form, but if you have to have some form of follow-up testing, and we strongly recommend that it is Binex Now, but you can use a different method. We would just need to know what it is. So again, I've kind of already mentioned a lot about the follow-up testing and Binex Now, so I won't go into that a whole lot right now. I guess this is where we kind of repeat the idea that if you choose not to use Binex Now, that you have to have a different follow-up test to be able to use. So I hope that's a helpful reminder. And then, when we think about following up on the test results, again, when the consent form that you're going to have parents fill out is going to help you get set up on the Project Beacon platform, so that then that'll kind of get those results to the appropriate school personnel from Binex Now, as well as to DPH. So we'll have a way of making sure that those follow-up test results get reported. And then I think if I'm in your shoes and I'm thinking about how do I get ready for this, what do I need to do right now? Obviously, getting ready for PPE is really important, and the kind of protective equipment that you'll need to have ready. And keep in mind, there's and we mentioned this last week in our webinar, but there's 2 types of specimen collection. There's either observed, which is down here, so personnel observing the self-administration of Binex Now need a surgical mask. if there are personnel actually collecting specimens, then they need a higher level of protective equipment. That's, no surprise. And the list hasn't changed from what we shared with you last week. So, if you're thinking about that early February launch, and depending on which type of collection you're going to use, we just know that we need to continue to move forward on getting the right PPE in place. So I hope that's helpful in terms of a lot of the kind of the prerequisites to be able to participate. Again, are the kind of forms you need to fill out for us, the forms you need your parents to fill out in the way of consent, the staff to fill out in the way of consent, getting the PPE ready will all lead us to a very successful launch at the beginning of February. So the next part of the memo details what the vendors will do. What are they responsible for? And I'm very pleased we're going to share with you that we have 3 vendors contracted to do this work. I couldn't be more excited about that. And all of them, regardless of which of the 3, are all prepared to take on these responsibilities, and I so appreciate their commitment and willingness to do so. So they're going to help, first of all, with operations and logistics of pool testing, which really means, the supplying, shipping, all of the materials to the district, like swabs, test tubes, label printers, any other necessary equipment. So, I hope that kind of brings down any kind of worry that you might have about those operations and logistics. The training, using a train the trainer approach, our vendors will provide that service. The software, we have done tech demos with all of the vendors and seen what I would consider very easy to use, intuitive software about how do you at the school level kind of code the information. Right now, for the 3 vendors we're working with at this time, there is not personally identifiable information going into the system. And so really it's, either a code or a name like room 10. And there was, we collected 10 samples from room 10. The tube either has a code on it, maybe a code and the name room 10, but that's basically it. It goes off to the lab. Your site administrator will have the ability to see those results and know whether or not the individuals who were tested in room 10 had a positive or negative result for that week. And so that software, I think you're going to appreciate the kind of simplicity of and the intuitiveness of what our vendors are providing for us. They will provide technical assistance and transportation to and from the laboratory, or to the laboratory. Now, I know a key question that a lot of you have is about, that's great, but what about if I need additional supports? What if, I don't think that I have the staffing to collect specimens or to provide oversight of this program? So we do intend to provide those services for you. All the vendors know this. They know that they need to be ready, if necessary, if you request, to provide on-site test specimen collectors, to provide a testing coordinator who can, kind of be at the district level to just oversee this work. And so we are happy to make that available if necessary. We do ask, though, that you look internally first to see, can we do this? How much of this can we do on our own? Because keep in mind, at the end of our 6-week early launch, you'll need to assume these costs and these responsibilities. And so, I think I mentioned this last week, one method might be if you're not ready now, maybe you do take advantage of some of these services that we're making available for a period of time during the 6 weeks while you are kind of ramping up your own staff or working out the kinks of doing pool testing, so that you can take this on your own, starting after March 28th, which is the end of this early launch. Or maybe you're ready and you have staff who can do this. I was so, again, thinking back on the webinar we heard from last week from Watertown, Medford, and Salem about the ways in which this seems daunting, but it's actually, once you get it going, it is possible to do this. It is possible to staff it. And so just really appreciate everything that you can do to find your own staffing first, but then as necessary, take advantage of our offer for additional staffing. We're very confident that we can provide what's needed, but of course, this is human work and we need humans to show up to do it. And so we'll be able to start soonest with districts that don't need these services. And we're gonna work like heck, frankly, to make sure we have them for the districts that do. But the less you need, the easier it is going to be to get going in the way of these additional services. So I'm actually not going to go into this part of the memo as much. I have a few highlights here, but not as much, because what I really want on your mind right now is what do I need to do next week? And so this part of the memo just sort of reminds you of what pool testing is all about. But I did want to point out a couple of key things here in this section for you to be thinking about today. And really one of the key things is about who can actually self-swab. I mentioned earlier that there's either pool collection or pool observation of the collection or direct collection administered by a staff member. And so really appreciate the consideration that our colleagues at DPH have given to this, and an approval to say that, keep in mind all of our vendors right now are using a nasal swab. It's the kind of, I'm calling it gentle interior, anterior nasal swab. My son had it done recently, I mentioned, and he called it gentle. And he is the type who is afraid of every shot from every doctor. And so if he calls it gentle, I can call it gentle to you. And students in grades 2 and up are able to self-administer. And, that can help with again, the staffing that's involved and how you're going to set this up. And so what I'd want you to have top of mind right now as you're looking ahead into early February as we launch this is, what grade levels do you serve? What collection you might need to set up for those primary grades versus what you can do for students in grades 2 and up. Is just something I'd want kind of front and center for your mind right now. And then, of course, we really just hope that we get as much participation from students, from staff, from faculty as we possibly can. The more we have involved, the better we're going to know about the extent to which the virus is occurring in our schools. And so just want to remind you that, we're saying that it's all school staff and students. And so contracted staff such as bus drivers would be included. So again, just want you to have that for planning purposes. I hope you're pleased to see that I don't have a lot more highlights here. This is looking ahead a little bit. And as a reminder, we'll be back together for an optional webinar next Friday for you to be able to come back to us and hear more about implementation. And I feel like a lot of the details here are more about implementation, and that's not what I need top of mind for you right now. In the next week, I really want you thinking about, kind of how you're signing up, how you're filling out those documents I showed you at the beginning of this presentation. And so a lot of this is much more about kind of that next level of work, but important to read now. So I now want to go to our 3 vendors. And before I mention further about the 3 that you see here, and again, I'm so very, very pleased that we have all 3 of these great vendors working with us. I want to mention that there are vendors that are working in the state that aren't on this list. And we are pleased to work with and work on contracting with any vendor that we can. But there are just a variety of reasons why this works for us in different ways than it might work for districts as they go into contracting. It's a lot harder for us, for example, to have personally identifiable information through our contract than it would be through a contract you would set up individually. And of course, cost is a huge factor too. And so I'll just scroll down. You can see that our vendors that we have set up through this contract have a price of $30 per pooled test. So that's for that group of 10, $30 to $50. And 85 for a larger group, 11 to 25 here for Ginkgo, and 5 to 10 swabs for CIC at $50. So we think of this as sort of like $3 to $5 per swab as being the range that we've been able to negotiate, and really appreciate these vendors setting up these contracts with us. But there are districts in this state that have done really great work with vendors who aren't on this list. And Commissioner Riley is very mindful of that. And those districts have helped show us the way. And so in the survey that I mentioned at the beginning of this, there's a question that says, do you already have a contract with a vendor not on this list? And we want to know that information because we want to look in to see, is there some way that we can kind of subsidize the work that you are already doing? I don't have that as a confirmation yet, but Commissioner Riley is very, very interested in this, very committed to this. Again, I've always said we can do this now for 3 reasons. We have partners like you see here in the lab capacity and the lab strength to be able to do this. We have the funding through the stimulus funds, and we have districts that have already done this work. And the last thing that I want is for any of those districts that have already done this work to feel penalized because the partners that they're working with are not on this list. So we are looking for solutions. So with that as my preamble, let me just dig into a little bit more about these three organizations. And I just can't help but put a smile on my face. To have CIC Health, Concentric by Ginkgo, and Project Beacon all available to us for us to match with you as partners in this work. And I think they are really going to be amazing at getting this job done. And they are already doing this work in our state in lots of different ways. And so I feel like they are very tried and true, very ready to go. And what's going to happen when you take our survey, that application survey, we are going to ask you, what your if you have thoughts about partnering with any of these organizations, but mainly we actually hope that you'll express no preference because it will be much easier for us to match you. If you are able to say that you're willing to work with any of these vendors. What we really want to try to do is to try to come up with some logical organization to which districts we partner with which of these vendors. So, for example, with transportation of the samples being in courier service of these samples being a key consideration, the districts that are in the Berkshires, as much as we can, we'd like to combine them together with one vendor so that, if you're working with Ginkgo, they're going to Ginkgo's lab. If you're working with CIC or Project Beacon, the results, as you can see here under the row that's labeled as processing laboratory, are going to Broad. And so just using the Berkshires as an example, we'd like to, have some economies of scale by, collecting as many samples as we can from across districts and then driving them to one lab is going to help us lower the costs of this initiative, both for us now and for you in the future. And so your ability to have less preference actually helps us actualize more of those economies of scale. And so I'm pleased that we have three. I think they are all really strong, capable partners that will be really ready to help you launch this initiative. You can see that we have information about the costs that are in, that are in our contract. I think it's really important to note up here that these are the prices that we have negotiated through March 28th. And what's going to happen in pretty short order, we are going to release our RFR to set up that state contract list that you can purchase on, that you can purchase from after March 28th. And so these are the prices that we have for the state contract. The prices might vary when they're not going to be the exact same prices, perhaps. We don't know, right? There's a procurement process that has to happen, and I know you all know that process. So I think they're a very good rule of thumb. I don't think they're going to be a lot different, but it's also why we kind of hope that you won't get kind of too married to any one of these right now, just knowing that they're roughly they're very similar. They're really close in the range, and again, we really appreciate their willingness to find their way to these contract agreements with us. So we hope that that this is just good information for you to know at this time, and then how you think ahead about it to ultimately purchasing these services off of the state contract. So that's mainly it for the overview of this memo. I just also want to mention that we have available for you an FAQ document, and that is available on our website as well. And I mentioned that it's updated as of today, so that we add a lot more questions. I won't go over this right now the way that I did with the memo, but I would ask you to take a look at this to be ready for it as well. And so I'm just going to go back. I'm not going to go to presentation mode just because I don't want to make you kind of dizzy with Russell going back and toggling throughout this presentation. But I do just want to talk about next steps and then turn to your questions. So when we think about next steps, I want to just reiterate the need to, if you haven't already done so, start applying for Binex Now. And really pleased that, again, our website kind of walks you through which use of Binex Now you're signing up for. And so if you're in pool testing, it's the follow-up for pool testing kind of strand that you want to go down as far as setting up for Binex Now. And then, as I mentioned earlier, completing the application and the statement of assurances is really what you need to do for us. And we very purposely put those documents you have to fill out at the beginning because they're going to take you a little while. You're going to need to go hunt down that information, collect it, and so it might not be a bad idea to, we've individually put those documents on our website, particularly that Excel spreadsheet that I showed you. We're going to have information by school. It might be something that you have to go and collect that information and then be ready to upload it to the survey and then move on to the rest of the questions that we have for you. And just that reminder that if you are able to submit those documents to us by January 28th, we can help to prioritize you for the launch of this process. And then, I mentioned already that, our start date is, most likely mainly February 8th. You will have the option to tell us if you actually want to wait till after February vacation. And just reiterating what I said earlier, that if you need the less administrative support, the less operational support that you need, we're going to be able to get you started sooner. So please look deeply at your need for those optional additional services. And we're going to do this matching on a rolling basis. So we're going to sort of collect a batch of your responses, again, try to organize them, not solely by geography, but, again, using that kind of easy Berkshires example that I gave, we're going to kind of batch them, look at them, and then wait for the next batch and see how we can continue to match effectively based on the feedback that you give us. But we really purposely made the survey not close, I'm sorry, I should never say close. The prioritization date being next Thursday. So we will actually be meeting on Friday and really all throughout next week to be working on those matches. And then I also, as I mentioned, I just want to reiterate the statewide contract will be available early to mid-March. So you'll be able to see, while you're still in our early launch, by early to mid-March, you'll be able to see what will this cost me? Who are those vendors? And you know what? We could have some of the vendors that aren't currently among those three that I just showed you. We hope that more will also sign up. So just because you don't see some vendors now doesn't mean that they won't come on to our statewide contract. We really hope that we have definitely these three and perhaps some others as well through that process. And so then finally, just quick information, I've already alluded to this, but we have 2 optional webinars coming up next week. Next Tuesday, our deeper dive, our deeper discussion on Abbott Binex Now. And then, and again, in collaboration with the Department of Public Health. And then on Friday, we'll be back together a little bit earlier, 1 to 2 next Friday, thinking about implementation strategies. And I'm just so pleased that the Shaw Foundation has been such a great partner to us, really listening and looking for what are those implementation strategies that are working across the state. And so really we'll be bringing to bear what we know as DESE, as Health and Human Services, as DPH, particularly in our work with the vendors and what we've heard from the districts, but then Shaw will also bring its accumulated knowledge to really support your implementation as well in that webinar next Friday. And hopefully by that point, you'll be a lot better able to talk about implementation. Whereas right now, again, I want you to focus on application, on getting those documents into us so that we can move ahead with the matching process. So application for the next few days, implementation starting at the end of next week. And that is actually it for me. Lauren, I'm glad now to go to Q&A, and I will stop my sharing. And maybe before I do that, because I've been talking so much, let me go to my colleagues from Health and Human Services and see if there's anything I missed. Jeremiah, Elizabeth, anything that you want to underscore in terms of what I mentioned during this webinar so far?
I don't have anything else. That was fantastic. Thank you.
Thanks, Jeremiah. If anything comes to mind later, don't hesitate. All right, Lauren.
Great. Thanks, Russell. So we have a lot of questions, and I'll sort of start from the top of our presentation and then go down. And just know we will be updating our FAQ with questions from the chat periodically. So just keep an eye out on our pool testing website for if your question wasn't answered in this short segment here. So Dr. Brown, questions for you about the study. So lots of people are wondering how many people were included in that study, and if you could just give just a brief overview.
Yeah, if only I could remember. So what I want to say is that we were very fortunate in that this was a very large study with Yeah, I can't remember.
Dr. Brown, I've got it for you.
Oh, thank you. Go ahead, Elizabeth.
2,482 participants, which was 1,380 adults and 928 children. And if you would like to dive deeper into the details of the study, that's what DPH will be going through kind of in detail at the Abbott Binex Now webinar next week. So we did originally, we hadn't had as many pediatric samples in the study, but they actually opened the study back up to add more pediatric samples so that we could really get a clear picture of the test's utility in children.
Elizabeth, do you want to put the link in the
We'll do.
chat just in case?
The preprint.
Right.
Yeah.
And I promise I'll have all the numbers in my head for Tuesday.
And Elizabeth, would you mind just mentioning what the preprint is? What will people see in the chat?
Sure. So this is a link to the formal kind of research study that was done between the Department of Laboratory Medicine at Boston Children's Hospital, the Massachusetts Department of Public Health, with our state public health laboratory with Dr. Sandy Smoley, as well as Lawrence General Hospital, which was kind of the site of the study. And then the processing laboratory was the Broad Institute of MIT and Harvard. So all of those folks kind of working together on this study, and the link it's kind of I'd say an overwhelming 26 pages of data and discussion, but our goal in the webinar next week would be to kind of walk folks through it and pull out what we feel like the most important key messages within that are. But for individuals interested in diving in, the preprint is the study that hasn't fully undergone peer review yet, but is in the process. So we wanted to get the data out there because we know it's incredibly important to decision making everywhere.
Great. So there were a lot of questions that came up about the statewide CLIO waiver. And so for districts and schools that already have submitted a CLIO waiver for their specific district, do they have to resubmit to be on the statewide list?
So I can take that one. So they do not need to resubmit. They are welcome to stay under their same CLIO waiver if they've already gone through the process. But anyone who has not heard back yet with approval, probably the fastest route will be to fill out the survey to kind of apply under the statewide CLIO waiver. I will note, and I just wanted to make this very clear, that the statewide CLIO waiver hopefully will take, all of the delay and the processing time out of what's required to apply for a CLIO waiver, but all the same requirements still apply. So pay special attention to kind of the training requirements and whatnot to make sure that, as a temporary site under the statewide CLIO waiver, you're, meeting the obligations of processing these tests on site. So there's more information on that outlined in all of the Binex Now documents, as Russell and Lauren outlined earlier. But all you'll really need to do is provide us the information around your school, a point of contact, and kind of attest to your understanding of the requirements to perform these tests.
Great. So a few questions about consent, and folks are wondering, do they have to use the sample consent forms that are provided to them on our website, or can they develop their own, and what fields are specifically required if they develop their own?
Well, we might need to get back to people on that question. I would say that we really carefully thought about which fields are required, and any of the background information about the individual that's needed for the follow-up testing has been very carefully vetted with DPH. So I would not want people taking liberties with the form, particularly if you're using Binex Now whatsoever. And so, maybe we could follow up to say, here are some places where we could see the information perhaps being optional, but by and large, that's the information that we feel like we need in a very kind of, we were very thrifty about what we asked for there, to not ask for things that we don't genuinely need. Elizabeth, I don't know if you have anything further.
No, I think the other thing to add there is ideally it will certainly streamline the process if you're able to use this consent, and we'll work on translating it into any languages that are needed to make that possible. I think, these are kind of intricate forms in their development, in that it was a joint effort between various state legal teams, both, DESE legal's team, as well as the EHS legal team, and with all of the vendors. And so we've really tried to agree between everyone to streamline things to a common consent form across all of the various vendors that are participating in this program. And those consent forms are really part of our agreement with the vendors that we work with. And so to the extent that those can be utilized, we probably would be okay with folks adding things, but taking things away would be more difficult.
Great. A lot of questions about how the electronic consent will work. People would like to avoid paper as much as possible.
Lauren, do you want to take
Jeremiah,
that?
do you want
Oh, sorry,
take that?
Jeremiah.
Gonna say
great.
Jeremiah.
Sure. I believe that all of the vendors are going to allow for electronic consent through their platforms that you can use for pooled testing and follow-up testing. Exactly what shape that takes is going to depend on the vendor, but they all have an electronic option, and they all also have a paper option. So if you do need to use paper, if there are certain families who do need paper, you're going to be able to get it on paper and then put it into the system. So no matter who ends up being your vendor on this, out of these three, at least for these 6 weeks, you're going to be able to do it through the platform.
Great. Russell, can you review the contract terms for our statewide contract with vendors? People are wondering, is the paid portion of the DESE contract, can it shift based on when districts are ready? Can they propose an alternative start date if they're not ready to begin at the beginning of February? Can you just remind people about our end date and when they have to take on their own costs?
Certainly, and then Elizabeth, I'm sure, please fill in anything I miss here. But what we want to be flexible. And so we're saying we're ready, we will be ready to start at the beginning of February, but if you want to start later, you certainly can. There comes a point though, obviously in March where it just wouldn't make sense to start on our contract and then switch over to your own contract. But really up through the beginning of March, we would like to kind of from early February to the beginning of March, and I'm pretty sure that's in our documents. We want you to be able to kind of flex into this, frankly, to do what's right for your local district. And one of the questions I got by email today was, our district might be ready to start with just the high schools, and then, for the first couple of weeks, and then we'll want to add during the 6-week period, add our elementary schools, our middle schools, and we're fine with that. You don't have to do kind of lockstep the entire district. I guess our strong request though, from an equity perspective, is that when you start a building, we would ask you to do the whole building. We don't want there to be haves and have-nots in terms of like leaving custodians out, for example. If you're starting the way that I just mentioned, it's kind of all in for that building, but not necessarily all in for the district. Elizabeth, what would you add?
No, I think that's right. We will work to get folks up as quickly as they can when they're ready. For some individuals that might mean if you're ready to start March 1st, DESE can, provide, can fund that through the 28th, and it might not be the full 6 weeks if you're kind of starting at one of those later dates, but we're more than happy for you to come in for those last, 4 weeks if like a March 1st timeline works better for you. So we're really trying to be flexible because we know schools and districts are in various places around when they ideally would start pooled testing within their buildings.
Great. So a few questions about if districts or schools already have contracts with some of the vendors, one of the 3 vendors that we've already contracted with, how do they go about participating in the paid portion of the program?
That maybe warrants some follow-up, because that's a more limited basis, and where contracts are involved, it's a little hard for us to discuss what might be the status of your current contract and perhaps how to shift over to this. Maybe we could, because we really appreciate the willingness of these 3 partners to come on board with us, maybe we could all have kind of an open discussion about what the possibilities are, and then get back to you with more details on that.
Great. So now about administering pool testing, who is allowed to administer these tests? Does it have to be a school nurse?
So I can take that one. So no, we are in the documents we kind of outline, we are okay with observed self-swabbing for pooled tests for surveillance purposes for students 2nd grade and above. And so what that could look like is it could take a lot of different iterations, but essentially a trained observer, whether it's a teacher or someone else who kind of knows how to supervise the process, could stand at the front of a classroom or do it with a group of students in a centralized location and kind of observe the students doing the swab of their own noses and kind of collecting the nasal specimens in a common tube. Other schools prefer the school nurse approach, and we've had kind of schools, I think, successfully do it both ways. So there's a variety of options on the table where it can either be trained specimen collectors, whether a school nurse or local EMT or something like that, or it can be the observed self-swab approach. At this time for follow-up testing, those swabs have to be done by a specimen collector, though it doesn't have to be the school nurse. It can be other trained personnel as outlined in the requirements on the Binex Now website. I guess the Binex Now documents on DESE's website.
Great. So there's a lot of questions about defining the membership of the pool. And so can it be a pool of both staff and students? Does it have to be only students or only staff? And so I wonder, Russell, if you can just give an overview of next week's webinar with the Shaw Foundation and sort of discussing best practices for the type of collection.
Right, absolutely. So when we get into that collection of 10 samples, we wouldn't want it to be 10 staff members, because obviously if there was a positive result, we don't want 10 staff members A, worrying, or B, waiting to get the results from the follow-up. And so we recommend combining a very limited number of staff with a larger group of students. So maybe, you know, one teacher with the 9 students, for example, just using one example. We do write in our memo though, or actually I think it is in the FAQ, the documents sort of run together a little bit right now. But we do say that if there is a sample that is only educators or only staff members, that the maximum should be 5. Because we just recognize the staffing issues that can create if you have more than 5 of just staff. And so we do contemplate the idea that there could be a staff only pool, but we do limit the size of that group.
Great. And do you just want to remind folks about the next week's webinar?
Yeah, absolutely. Yep. So next Friday, 1 o'clock. And it's in the link is in the PowerPoint that Lauren put in the chat. It won't be in the link that we put up on our website because it is by invitation. It is for the districts like you that are interested in participating, but we will email that out again to all of you who've expressed initial interest so that you also just get that reminder about the link for the webinar next Friday at 1 o'clock on implementation strategies.
Great. So I think that covers our questions for now.
Great, great. So our colleagues from Health and Human Services and DPH, any final thoughts as we wrap up for today?
Not from me, thank you. I just want to, Russell, acknowledge the partnership between EHS, and DESE and DPH, and really have appreciated the collaboration. And we hope this will be a helpful program to schools to keep our kids in school.
Absolutely, absolutely. Those are so we're all working towards. So thank you very much, and thank you for the collaboration, and for all of you for being here today. We look forward to seeing you next week. Those of you who want to attend either of our optional webinars, and certainly please feel free to use the resources that we're putting up for you today. Send us your questions, and we look forward to getting your responses to the survey and getting that statement of assurances, getting that application to be an authorized school, and then we can keep moving forward. Have a great weekend, everyone. Talk to you soon.